The Ogun State Governor, Dapo Abiodun, has disclosed that his government would set up a committee comprising of stakeholders and practitioners in the health sector to bring back the old glory of the Olabisi Onabanjo University Teaching Hospital. The governor, who lamented the poor state of Olabisi Onabanjo Teaching Hospital, Shagamu Remo, described it as worse than deplorable situation following an on-the-spot inspection to the teaching hospital in Shagamu, Ogun State. Our correspondent Michael Adesonya reports. The governor was an on-the-spot assessment to the teaching hospital after numerous reports he received from the medical advisory committee set up before his inauguration. The reports, according to him, were disheartening. Thus, the need to hit the ground running by giving the facility a facelift. The governor also assured that the state government will critically examine the hospital projects earlier initiated by his predecessor. He added that he will work towards ensuring that courses lost by the teaching hospital regain their accreditation.
And I'm sure you followed me around and you've seen for yourselves the condition of this place. It is worse than deplorable. I intend to immediately put together a team of both consultants and members of the sector as well. After I get a formal report from the medical director and his team, I intend to set up a team to look at how we can immediately begin on a phased-out approach to begin to ensure that this place indeed becomes as functional as it should be. At the present time, I don't see how this place can produce doctors that would be seen as doctors that actually would be able to look after patients. I don't see how they even have been able to manage to look after patients. So we have to go back to the drawing board. I understand that they've lost a lot of accreditation, which is not surprising based on what one can see here. Most of the buildings that are here are buildings that were inherited from the old State General Hospital. Not much has been done.
On our part, the chairman, Medical Advisory Committee to the Teaching Hospital, Oluwabumi Fatuaje, appealed to the governor to provide building and medical facilities for the hospital so as to meet up with the challenges of modern medical practice.
Well, the medical facility we started years back as a general hospital, and we were probably about 100 bedded as at that time. But after some years, we expanded. It was converted to a teaching hospital. It means we have facilities to train medical students and train resident doctors. So our capacity increased. Do you understand? So we are about 300 bedded now. So 330 bedded. You cannot imagine having enough facility from 100 to 300 bedded. So it is overused, over-exhausted. That is what is happening to us. And so we have contracted space. So we need to expand. We need more equipment to see patients. For instance, now our inpatients is between 7,000 to 8,000. The same number of personnel that has been managing those 100 bedded are the same ones we have. Part of them have retired. We had to replace with casual staff, casual workers. So we need more personnel. We need more infrastructure. We need more.
However, the governor promised to pay the hospital bill of a police officer, Adejo Veronica, who was delivered of a set of triplets at the teaching hospital.